I'm Dr. David Rapaport, and I want to talk about what's new in breast implants, because there's a lot of news right now. Basically, for years, we've been hearing about gummy bear implants. Well, guess what? In the last couple of months, two kinds of gummy bear implants are now on the market for the first time in the United States for cosmetic use. So briefly, I'm going to go over your implant choices. I don't have one to show you, but historically there are saline implants, and I continue to use them, and I think they continue to have a role, even though, for example, in Europe or South America, you're really not going to see them. Saline breast implants you can put in through a smaller scar, and they're terrific behind a good breast. So someone that's really flat-chested, they're really bad because they will feel very fake. But a saline implant behind a size B breast, for example, that's only becoming a full B small c, might in many cases be the best choice of all. Nonetheless, in most cases I'm using silicone, probably because women are thinner and the feel it becomes very important, and saline isn't as good on women with little breast tissue and little body fat, which most of my patients are like that. So historically, the biggest implant in the United States by far for cosmetic use is the smooth, round silicone implant. And this is an example of one. It's a large one. It's 435, so it's an implant I'm rarely going to use in terms of the size, but this demonstrates a smooth silicone round implant. What's great about it is that it's going to feel the most natural. It's going to move most like a normal breast. The problem with it is that compared to the textured implants, which are out now and becoming more popular, the smooth implant has the highest chance of a capsular contracture, which is hardness. And if you're blessed by not having any firmness at all, the smooth implant also can have a higher risk of bottoming out because the scar tissue isn't holding it, so over time it can just get lower and lower as it moves through the tissues. Textured implants are very interesting. This is a round textured implant. We've had these for a while, but they're becoming more popular now. The main advantage of this implant is that it comes with a lower risk of contracture. It's complicated to explain, but that seems to be observed in many, many, many studies, that the risk of serious hardness with this implant is much lower than with the smooth silicone. But that comes at a price, and that is that this doesn't feel exactly as natural and doesn't move quite as naturally as breast. What I explain to my patients, what people don't by instinct want to hear, is there isn't a perfect breast implant. Whatever you pick, you're gaining something and giving up something else. So textured implants have a role. Historically, I would use this to treat a contracture, but not as a primary implant. Now, under selected cases, I'm using this more and more as a primary implant. Finally, what's brand new is this gummy bear type implant. So this is an implant that isn't just textured, but it's also shaped. The advantage that it offers is also its disadvantage, and that's that the silicone inside is even stiffer. So you see, it doesn't collapse at all. It keeps this upper pole fullness, and again, that can offer some women an advantage. I personally believe that this implant is not necessary in most women. It does complicate the operation more, because when you put it in, it has to be perfect. It can't be rotated at all, or things can look funny. Pretty much this implant cannot be put in through the underarm because of the possible problems with rotation. It's only put in with a scar under the breast. And again, I think in the overwhelming majority of women, this would not be my first choice. My first choice is usually going to be a smooth implant, saline or silicone, and in selected cases, a textured implant. You really have to come in and meet your doctor and have a detailed evaluation, and it has to do with a lot of things, with the shape of your breast, the skin envelope of your breast, the soft tissues, your goals, what's really most important to you, so what trade-offs make the most sense for you, and that's what we figure out during a one-on-one consultation. Thank you very much. I'm Dr. David Rapaport.